Hello friends, today the point of discussion is a very important virus called dengue virus and the dengue fever that is very common in the community nowadays after the COVID outbreak. We got some relief from COVID outbreak, but dengue has been coming year after year, and the most important cause of dengue is the filth around us, that we do not keep our surroundings clean, and that this is caused by a mosquito, Aedes aegypti. It's a mosquito-borne infection and the virus is dengue virus. I think everybody in India has had a dengue infection in their lifetime because it's been there every year, sometime more, sometime less. But again, once the outbreak of dengue virus in this season, we should actually revise as to what should be the do's and the don'ts about dengue. The dengue fever is actually divided, when it's classified as a plain dengue fever, as a dengue hemorrhagic fever, as a dengue shock syndrome. In the dengue fever, basically the patient continues to have high grade fever, body pain, vomiting and nausea and sense of unwell. The patients usually have a complaint of fever, bone breaking pain. This is actually the other name of dengue fever, bone breaking pain. They have a lot of bone pains, and there is a retroorbital, there's something, a pain behind the eyes, which is actually of a lot of discomfort to the patient. And in this group of patients, the patients will be dengue positive, but the platelets would not show a significant fall. The other group of patients is when the platelets tend to fall, which usually do so from 4th to 7th day of infection. And we have to keep a watch on the platelets, and if the platelets go below 60,000, then we say that it's a risk factor, and then we need to admit the patient in the hospital so that we can monitor the other days in the hospital. The third subset of patients is the most grave patients, which is dengue shock syndrome, where the blood pressure tends to fall. And these are the patients which require immediate hospitalization and intensive care unit, and these are the patients who present with mortality as and when. Now, how do we diagnose dengue fever? Apart from the clinical features that I have mentioned, the dengue fever can be diagnosed with a blood test, which is an ELISA test, a blood test. NS1 can be diagnosed on day 1 of illness, and if it is 4 to 5 days old, we could actually do the serology, that is dengue IgG and IgM levels. I would like to remove a misconception over here, that many a times you tend to have dengue IgG positive. Let me tell you, dengue IgG indicates a past infection which can be present for at least 60 years after the dengue infection. But dengue IgM indicates recent infection which could get positive from 5 days to about, and could persist for about 2 to 3 months in your blood. So it is dengue IgGM and dengue NS1 which is more important. Having diagnosed the treatment, let me tell you friends, there is no role of antibiotics in this viral fever. The only thing is rest and fluids. We have to keep a watch on platelets as well as the hematocrit. It causes a lot of hemoconcentration, and the only treatment is fluids, whichever way the patient can take. If the patient can take orally and can have rest at home, nothing like it. But if they are unable to take orally, we admit the patient and give IV fluids. IV fluids is to counteract the hemoconcentration that occurs along with dengue, and the treatment comprises of symptomatic treatment as something for his acidity, pantoprazoles and paracetamol to bring down the fever, and a lot of fluids and some B complex vitamins for the well-being of the patient. We do not give any antibiotics to the patient. And 4th to 7th day, we usually check the CBC, complete blood count, where the platelet levels are checked. If the platelet level goes below 60,000, we admit the patient. If the platelets do not fall below 60,000 and the patient is eating well, he can stay at home. And usually the recovery takes place within 5 to 7 days. And after that, there could be post-viral fatigue syndrome for about 2 weeks or 3 weeks, which occurs with any virus. And at that point of time also, you need to have a lot of fluids, vitamins and good food. So friends, the most important point we should remember about dengue is that we have to be aware that there is no unnecessary treatment, number one. Number two, fluids as water is the only treatment. Number three, keep great vigil on the platelet counts, and 5 to 7 days, 4 to 7 days is the risk period. And we all need to join hand together to see that it doesn't come year after year, and this can only be done if we can have a proper vector control, that is a mosquito control, whereby we can reduce malaria and dengue. And let's hope everybody gets well this season also with dengue fever. Thank you very much.